Well, again, thank you so much for joining us this morning. I'm Alexandra Oropesa, Public Health Liaison for Southwest Maricopa. And what that entails are, again, it's the whole region that covers the cities between Taos and Altahela Bend. And this morning, we're going to be chatting about the Community Health Needs Assessment results. And so for those of you who weren't familiar with this image, it is actually in the city of Towson. It's a beautiful mural that's at their intersection of 91st Avenue and Van Buren. So next time you're in that area, feel free to stop in and take a look. They have a brand new art exhibit and it's really beautiful. So next slide. So a quick overview of our agenda. We will be going through introductions throughout the presentation. You'll get to meet a couple of different staff at Public Health. We will go through the CHNA overview, which is the Community Health Needs Assessment. You'll get to have a better understanding of what that process looks like. We'll provide a super short video, so you can have a better understanding. And then we will also go through the survey results. Several of you who are on the call this morning either took the survey or you were a great partner in ensuring that everybody's voice in Southwest Maricopa was heard through the survey results. And then we will also move into addressing the Community Health Needs Assessment priorities. So you'll get to see some of the priority results from the county, and then you'll also see those for Southwest specifically. So you can kind of see how the work will move forward. And then hopefully we'll have some time at the end to have a brief discussion about the results. Next slide, please. Okay, so as far as the objectives, we want to make sure that everybody has an opportunity to really be able to have a strong understanding of what the CHNA process looks like for our communities, and then what impact that process has on the community. We will be able to have a good understanding of the results that are specific to Southwest Maricopa. And then in some cases, we do have some data that speaks to each of the cities. We will also talk about accessing and sharing the MCPH information as far as the data, so that you all can use the information as you're planning your programming, your developing processes, and then potentially even as you're out there pursuing different grants. We want to make sure that you're utilizing the data in a way that's meaningful to improving health in your community. And then we are currently in the process of working on our community health improvement plan. There's lots of opportunities for you to get involved at different levels. So that'll be another component that we cover today. And then I know it's only 2024, but 2026 is around the corner as far as the Community Health Needs Assessment cycle. And so again, having all of you participate in whatever level you're most comfortable and able to, we're definitely going to share those opportunities. Next slide, please. So just a couple of housekeeping rules. If we can ask you all to enter the questions into the Zoom chat, we will have some time at the end for questions and answers. And Annie and one of our other colleagues, Irene, will be monitoring the chat as well. At the end of the presentation, we will have an evaluation because we want to hear your feedback. We'd like to know what we can do differently or more of. And then, as you all noticed upon entering, the webinar will be recorded. And so we will be getting the webinar and the slides that we're going through out to everybody within about 3 to 4 weeks. Next slide. Okay, so for this particular slide, I think we're going to go through introductions for our team. Is that correct, Annie? Okay. So starting with myself, in looking at the names for people that are on the call this morning, I feel like I've worked quite heavily with most of you, or in one way or another, I've already interacted with you. If I haven't and you're new to the concept of a public health liaison, I'm your public health liaison for Taos and Altahela Bend. I do have a master's in nonprofit leadership and management from ASU. And my background is actually in home visitation, early childhood development, and that was kind of my previous job in Southwest and Northwest Maricopa specifically. But I've actually been with public health since 2020. So I started during the COVID response. And next slide. So as I mentioned, our cities, I have them listed out here with your approximate population. Again, this is from the most recent census. So if it's a little off, I do apologize. I know numbers are growing and Southwest specifically keeps growing on a daily basis. So for Avondale, Buckeye, Goodyear, Gila, Bend, and Tolleson, I do also do quite a bit of work out in Tonopah and in Palo Verde. They're not listed out, but it's part of the region. And then same thing with Cashin, which tends to get bundled into Avondale. But for my Cashin partners on the phone, I want to make sure that you all know that I'm also here to serve you. Okay, so for this one, let's see here. Okay, so for our CHNA overview, oh, I apologize. Sorry, you went to my next slide. So this upcoming video that we're going to be playing, it will give you an overview of the CHNA process, and then we'll move into the findings that are specific to the region. Go ahead, Annie.
What does health look like in your community? Join us as we explore the health and well-being of residents of Maricopa County through our upcoming Community Health Needs Assessment Survey, launching in March 2023. Maricopa County Department of Public Health strives to create a healthy, thriving Maricopa County for all by listening to what's important to the community and engaging people in meaningful ways. To do this, we collaborate with healthcare systems and community partners to conduct a Community Health Needs Assessment, also known as a CHNA, every 3 years. By working with community partners, we have increased the level of resident input we collect over the last 10 years. When more residents reflecting the diversity of Maricopa County take the survey, you can better identify and address the issues that people in our community care the most about. What has CHNA data shown us so far? For the last CHNA, we conducted 2 community surveys, one standard survey in 2019 and a supplemental survey in 2021 about the impacts of the COVID-19 pandemic. Across these 2 surveys, the community identified the following priority areas. These top priority areas also emerged in stories shared by the community. Here's one story shared by a community member regarding their physical and mental health impact.
So where does this data go after it's collected? The CHNA data has sparked action to accomplish the following. Share data with at least 7 major hospitals and healthcare providers to inform new approaches to serve the community. Center community voices to inform decision-making for program and policy development. Direct funding to local community organizations to address top community needs such as mental health, access to care, and social determinants of health. And inform the CHIP developed by over 100 community partners who form the Health Improvement Partnership of Maricopa County. The CHIP is a long-term systemic effort to address health needs based on results from the CHNA. What else can promote well-being and health equity? We look to community members to tell us in the upcoming CHNA launching in March 2023. As a leader in Maricopa County, your partnership is key to that success. Our collective efforts to promote the survey among our networks, both virtually and in person, will help ensure that we capture the most representative community data. We hope that our collaboration will provide strong opportunities for Maricopa County residents to achieve lifelong health. Visit maricopahealthmatters.org to explore past survey results, complete the CHNA interest form, and become a CHNA champion today.
All right, so Alexandra's having a little technical difficulties, so you'll be hearing from me for the next few sections till she is back on. But what we are excited to share about is that video is a video that we put out in 2023, really as like a call to the community to help collect data because it informs a lot of important initiatives. And y'all really showed up through so much community support and partner participation. We were not only able to meet the goals for representation, but we exceeded the amount of surveys we collected. So as you saw, in 2021, we collected 14,000 surveys. In 2023, we collected 18,000 surveys. And what's really important about that is the number of surveys collected were much more reflective of the demographics of our community. So as you can see here, we had nearly 1,000 veterans take the survey, almost 1,400 folks living with disabilities, 2,000 LGBTQ individuals, and almost 1,700 individuals who identify as refugee, immigrant, or migrant. So really that coming together to prioritize data collection has been incredibly impactful. And as a result, you're going to be able to see a lot more detailed data. So as we're going to be going over some of the data sections, you're going to be able to see data by special population, data by region, and by city. So we're just really excited to be able to do that deeper dive into the information because of how much support there was for getting this survey out into the community. So let's talk about city profiles. I know many of you represent some of our different cities in the Southwest region. When we create the kind of cutoff for city profiles, we have a minimum number of respondents that we need to collect to create a profile. So we have to have at least 250 responses from residents of that city to be able to publish that data. There's a few reasons for that. Some is to ensure that responses are reflective of the broader population. And so we want to make sure that there's enough responses to really get good insight and not just, okay, what are a couple of families thinking? It also helps us break down data. So you'll see as we get into some of the city data is that we're able to look at what some of our subpopulations were able to identify as well. So in 2021, we had 12 cities that we were able to publish profiles for. And then in 2023, we were able to add 3 more, so a total of 15 cities, which is really exciting. And the new cities that hit the map included Avondale, Tolleson, Fountain Hills, and Queen Creek. So 2 of those cities are in the Southwest, so major shout out to those of you who are working hard to get Avondale, Buckeye, Goodyear, and Tolleson on the map. As you can see, you're our only region who doubled the number of cities that have been represented in profiles. So definitely hope you all feel very proud of that, and we're excited to get into some of that data. Another thing that we wanted to share is that you might be saying, why is my city not represented? So again, we needed to hit 250 responses. So these are our cities that across the county that had responses, but that were under that 250 mark. So if you want to kind of see where your city stacks up, you can take a look and see, you know, how much we're going to have to put in some more effort in future years to get that profile on the map. But we still had a really great representation. And these cities that maybe didn't have enough for a profile, the data collected did go into our overall regional data and county data. So all these voices are reflected in that regional and county data.
For this particular portion of the presentation, it's a really good visual of just the amount of partners that it takes to really move through the community health needs assessment data collection process. And so we really wanted to take a moment to thank all of our partners. Since 2017, we have been able to provide mini grants, which allow us as a department to partner with different organizations that are addressing or working with a variety of community members. And so through those grants, we've been able to obtain culturally appropriate survey recruitment processes through diverse communities. Last year, we had 23 community-based organizations, and they were able to, or you all were able to really assist in data collection. And so the really great thing that I just want to highlight is it just how many different partners it takes to actually get through this process, make sure that we're hearing voices from not just one specific region or not just one specific part of the community. So thank you so much for that. I hope that you felt appreciated and valued throughout this process, because that is one of our goals, is to make sure that we're not just staying engaged during the survey collection period, but just throughout the whole entire year and throughout this whole process. Next slide, please. So for this particular portion of the presentation, I do just want to acknowledge the city of Goodyear, the city of Towson, Avondale, Litchfield Park. Actually, to be honest with you, all of the cities across Southwest Maricopa really did a great job at showing up during the 2023 collection period. Gila Bend, which is the furthest reaching city in Southwest Maricopa, also did a really great job at allowing myself and others from the department and our volunteers to go out to community events and within the cities, talking to your employees, talking to your volunteers. It was really an amazing experience for me to be able to do that. But that all really actually is a part of our process. So we do set goals. We do have communication plans in place. We do monitor the rates of survey participation. So some of you may remember in 2023, I was either emailing you or calling you or meeting with you to say, we're almost at that 250 mark, or what other events do you have coming up, or what ideas do you have, or what resources do you have to make sure that we're getting all of our residents to participate. And so I think those are definitely some of the keys to success for us. Next slide, please. And as I mentioned, we did have quite a bit of events out in the community. We had 18 weeks of data collection. We had 68 staff and volunteers. Shout out to the MRC, the Maricopa County Reserve Corps, if we have any of those on the line today, because they definitely were very helpful in getting out to these events. We attended 187 community events, and this is across Maricopa. It's not only for Southwest Maricopa. But we did spend over 1,300 hours at a variety of events. And then we did have the last collection period, we did have some funding. So we were able to put together some giveaway kits. And for those of you who took the survey and took a kit, those were some of the items that included our heat kit. We had a salad shaker kit. And then we also had a safety kit for vehicles. So those were quite popular. People were excited to take surveys because they were able to get something fun to take home. So thank you for that. And next slide, please. So now I'm going to hand it over to Annie, who's with us, and she will go through the survey results. Thank you, Annie.
Thanks, Alexandra. So hi, everyone. My name is Annie Damude. I work in our health outreach, partnership, and equity division. I am the community health needs assessment, or the community health assessment and impact supervisor. So I have the pleasure of working with a team of folks who conduct the needs assessment. It's a huge effort across the county and across the community. And then also I lead a coalition of healthcare partners. So we have the Synapse Coalition with hospital and federally qualified health center partners who come together and use a lot of this data to really inform their health delivery practice, community benefit work, et cetera. So, what's really exciting is that we get this data that informs our work at the county level, and it hopefully informs your work at the community level, as well as bringing that community-based public health approach to our healthcare systems. So it's a really fantastic integration across many different sectors, and it's so exciting to be part of this. So what we're going to do is we're going to talk about some of those results, right? We mentioned we have those 18,000 respondents. that really allowed us to kind of dive deep into what the community is experiencing and is thinking as we look and see how do we improve health and access for all. So we really want to equip you to be able to access and share community health data for use in programming, policies, and grant writing. So we'll start off by talking a little bit more about why we were able to increase data collection. So we've been doing community health needs assessments since 2012, where we got just under 1,000 responses. And as you'll see, the number of survey responses really increased over the years as we added additional features. So first year we did English and Spanish surveys in paper. The subsequent year, we're able to include some grants for outreach. By 2019, introduced a virtual format with a regional approach of recruitment. 2021, we also had many additional languages added, but no paper format because of COVID. And then in 2023, we had paper and virtual in 13 different languages with 23 partners that were specifically working for different demographics, as well as other community organizations, cities, towns, healthcare agencies getting this out. So we're excited to see how this continues to increase in future years. When we look at a community health needs assessment, the purpose of it is really to understand community experience, values, and ideas for how we can kind of make a difference. So there's 3 components that we typically collect data on. One is the community survey, and that's really what we're going to be talking about today. We set and monitored recruitment goals so that we didn't just get the same demographic taking the survey over and over, but that we got people across the county, different walks of life, different ages, races, focused population, et cetera. But we also conducted focus groups. So there's in-personal and virtual focus groups. And these were really focused on specific populations. So we had several that were targeted for youth focus groups. We had many that were for refugee, immigrant, migrant, for our LGBTQ groups. And those were conversations that allowed us to get a little bit deeper into what the community is experiencing than just, checking some options on a survey. Lastly, we did key informant interviews. So those were virtual. They were, I think over 20 individuals were identified, leaders across different sectors, to speak to really what are some of those kind of environmental and structural and community impact level phenomena occurring that could be addressed and can kind of intersect to improve health. So what's exciting is that we have reports for all of these on our maricopahealthmatters.org website. You can read like pages and pages on the focus groups. It's a great place to get quotes and stories and key informant interviews also to kind of hear what are leaders in these sectors talking about. But that's just a sneak peek because today we're focused on the survey. So before we dive in, I want to give a data interpretation example because I know sometimes, some of us may be more or less in the numbers, in the math on the day-to-day. So I want to make sure we all feel equipped to really try to interpret the data that we're going to see. So here is the format that we're going to be presenting. You're going to see your survey question up here at the top. So this survey question is, how would you rate your physical health? And folks who responded to the survey have the options of writing good, fair, or poor. This overall, that 8% overall, is the number of all respondents who reported poor physical health. So for example, as we look at the Southwest region, we'll say 8% of everybody in the Southwest region who took the survey said that they had poor physical health. And then what we're doing is we're comparing the overall Southwest participant responses to some of the subpopulations to identify where there's disparities, what groups might be having more significant health issues than others. So what we did is when folks took the survey, we also asked them to identify their race, ethnicity, their age, their gender, their income, and if they belonged to a focused population, for example, homebound or living with a disability or a caregiver or a parent. And what we did, as you can imagine, there's a lot of options, right? So we looked at those, if you count it out, it's like 40 or 50 different options of groups of people, how all of those groups responded to this question. And we said, which of those groups had the highest proportion of people who indicated poor physical health? And those are the top 3 that you're going to see where it's divided out. So among people who took the survey in the Southwest region, those with disabilities, those unhoused, and those income less than $15,000 annually ranked the poorest physical health. So another way to put it is that over 1 in 4 disabled respondents and 1 in 5 unhoused respondents reported poor physical health compared to 1 in 12 overall respondents. So what does this mean? An example interpretation could be disabled and unhoused respondents report the highest rates of poor health and may benefit from additional support and resources. Now, I know we turned off, I don't know that we have the chat feature for y'all, but if you're able to do a reaction and you want to give like a little thumbs up if we're tracking, or if you have any questions, you can go into the chat. You can message you can message myself, Alexandra, or Irene as co-hosts and let us know if you would like further clarification on this. Like we said, all the slides are going to be available in a few weeks after this presentation. And we'll get some practice because we're going to dive right in. So as we look at the Southwest region of results, you can scan this QR code. We're also going to drop the link to the Southwest region report directly into the chat. And so you can follow along on the Southwest region profile that we're going to be diving into. So we had 2,203 participants who live in the Southwest region take the survey. The featured profiles where we reached 250 responses or more include Avondale, Buckeye, Goodyear, and Tolleson. We really saw the most inclusive survey yet. So when we're looking here at our population, we're comparing the percentage of individuals who live in the Southwest region to the percentage of folks who took the survey and how they compare for demographics. So for example, 3% of folks who live in the Southwest region identify as American Indian or Alaska Native. 4% of the people who took the survey who live in the Southwest region identify as American Indian or Alaska Native. So what we see is when these darker blue percentages are higher than the base population, that doesn't mean that there was a higher number of people that took the survey than that live in that area, but proportionately, we saw really good representation. So for example, we saw a higher proportion of Asian and Black or African American respondents take the survey than that you would expect just based on the percentage of the population. What's good about that is when numbers are small, it gives us even more data to be able to look at those breakdowns and see how these populations are affected. We'll also see that age under 18 years was only 7% of respondents compared to the population of 27%. That's because we only conducted the survey for those age 12 on up. So we do not have any infants or any elementary school children who took the survey. But we did get very good responses from our age 65 years or older, which is great. So we have a lot of good data on some of our older adults. As usual, we had less representation from our male population, even though we really worked hard to engage that population, and some overrepresentation of females who took the survey. And then as far as annual household income less than 50,000, that was fairly on track with the population, those who took the survey as well as the population. So just to give you a sense of how closely these results kind of line up with the folks that you're seeing and serving in your community. Okay, let's get into the fun stuff. So when we asked participants what health issues have the most impact on you and or the people you live with or care for, we're going to compare results from the county to the Southwest region. And we found that, the order is a little bit different. However, there was the same top 5 issues identified. So we had, for the county, anxiety, depression, number 1 and 2. High blood pressure, followed by chronic pain and diabetes. Whereas for the Southwest region, the number 1 issue was high blood pressure, followed by anxiety, diabetes, chronic pain, and depression. When we looked across the different cities and towns, because we also compared, if we look at the 4 cities and towns that had the 250 responses, did they have a different set of like these top 5. I think we asked about 20 different health conditions. And those 4 cities and towns all had these same top 5. So across the region, across the county, across your featured cities and towns, these were literally the top 5 issues that, that were identified by survey participants. We asked, how would you rate the following assets in your community? And the options included good, fair, poor. So we're going to be showing the top assets that were rated as poor. So for the county overall, access to affordable housing was the top issue that folks reported as poor, followed by access to quality public transportation and ability to communicate with local leadership and feel my voice is heard. So the Southwest region, two of those features were similarly rated poor, which is public transportation and affordable housing. However, this box shows a little different. So instead of the ability to communicate with leadership, making that top 3 in the Southwest region, access to quality and affordable childcare was ranked as more, kind of a worse ranking in the top 3. So that's anytime that we come across something that's different from the overall county, we put that in a box. And then when we come across things that were different based on your city or towns featured, we put that in the little tab. So for example, Buckeye, among their top 3, they also included access to affordable education after high school. So that was a Buckeye specific top 3 asset rated for. So now let's talk about what's going well. So for those that were rated as very good, at the county level, we had access to parks and green spaces, which was also top 1 rated for Southwest region. The next one was opportunity to participate in religious, spiritual, or cultural events, and feeling safe in your home. Feeling safe in your home also made top 3 for Southwest. But one of the other ones was access to public libraries, community centers, and educational events, which was rated high. And then Buckeye and Goodyear, amongst their top 3, included access to safe spaces to exercise and be physically active. Which means the other 2 cities, Avondale and Tolleson, the top 3 matched the Southwest region. If you're not seeing it here, it's because it's the same as the data that we already have available. So when we asked folks to rate their physical health in Maricopa County, we had 8% of folks overall rate their physical health as poor. In the Southwest region, 6% rated their health overall as poor. This is where we're getting into those subpopulations now. So we looked at all of these different responses compared by race, age, gender, etc. We found that those with disabilities, those unhoused, and those with income less than 15% were the major groups that had the poorest physical health, both for the county and for the Southwest region. I will say that some of your cities and towns have different subpopulations. It was getting really crowded to put them all on the slide, but that's where we want to reference you back to the Maricopa Health Matters reports, because there are profiles like this for each of those 4 cities and towns. So you can see what subpopulations in Goodyear ranked their health as more poor. So then looking at how would you rate your mental health comparing county and region, 10% of folks across the county rated their mental health as poor, and 8% in the Southwest region rated their mental health as poor. For both comparing county to region, both LGBTQ+ made it to the top 3 of poorest mental health. But one difference is that in the Southwest region, we had a higher proportion of Native Hawaiian and Pacific Islanders and those aged 19 to 24 that identified poor mental health. So that kind of shows that those specific populations in that region are having kind of even more of a struggle with mental health. And again, these subpopulations are going to be different from your 4 different cities and towns. So we just want to give that as a teaser, encourage you to look through your reports and see which of your subpopulations are facing the most physical and mental health challenges. We asked, how often can you get medical care when needed? So in Maricopa County, we had 36% say they could only sometimes or never get medical care, versus Southwest, we had 32%. So it's 1 in 3 people say that they could only sometimes or never get care when needed. And in the Southwest, we had those aged 19 to 24-year-old, income less than 15,000, and refugee, immigrant, and migrant as the top 3 that had challenges getting mental health care when needed, or medical care, sorry, when needed. The next one is about mental health care. And so we saw that, about 1 in 2 folks in the Southwest region had only sometimes or never could access mental health care. Compared to the county, Asian and refugee immigrant migrant were some of those top 2 populations that had the most issue getting mental health care. However, instead of Native Hawaiian and Pacific Islander, which was the case for countywide, for the Southwest region, senior living in a group, that population had a higher barriers for getting mental health care when needed. All right, and we're on our last data point for here again. All of these different measures are included in the regional and city town profiles, so I encourage you to look into them. But we asked a question: what would help you get the care you need? And this question was asked of everybody, whether or not folks said that they struggled to get healthcare, because we know that even for people who always get the care they need, there's likely some things that could make it easier, right? But for both Maricopa County and the Southwest region, evening or weekend appointments, more appointments available, and lower out-of-pocket costs for services were the top 3 facilitators that would help folks get access to care. We did see Buckeye and Goodyear identified a couple other factors in their top 3. So Buckeye asked for services closer to where I live, and Goodyear multiple services at the same location. Tolleson and Avondale had these same top ones as the region and the county. So I know that we have a lot of the substance use crisis is huge, and so our PHLs asked if we could pull additional quotes and stories from community members. And so this is for countywide. We have a couple quotes from our youth focus groups, and these can also be found again in that focus group report. These are long, but one of the low-income youth focus group participants was talking about folks not having access to a therapist. There's a lack of education, how to handle your emotions, that there's a big barrier that we have in our community is having resources and being able to have that accessible to folks. In the Native American Youth Focus Group, they've really talked about some of the kids and people believe us being who we are, what we're interested in, are less than what we do, what we look like, and really like kind of that lack of identity influencing people to go on and use drugs. But that is something that having more attention to, more resource for would be very helpful. And then for another youth focus group, there's a substance abuse issue in schools. And instead of doing a punishment approach, how do we have resources to put folks on the right path? So just some examples of data that came from the county at large. We then looked through the Southwest region, and from on the survey, we had an open-ended section where we said, is there anything else you'd like to share about your health or the health of your community? We had over 4,000 responses of the 18,000 people who took the survey. And so we kind of filtered it down to see who also mentioned substance use. So somebody from Avondale said we need to make substance abuse free health and mental health. These are taken directly. So occasionally, if the wording's a little interesting, we wanted to reflect what folks were saying, but just wanted to explain. From Buckeye, we need more substance abuse and mental health assistance. Too many of my children's friends have died. We need more school counselors to identify issues prior to suicide or self-medication overdosing. Nila Bend, this quote was originally provided in Spanish, but mentioning need for assistance for medical insurance, help with utilities, activities to prevent children from thinking of drugs. And lastly, from Gila Bend, there's a need for services on weekends and holidays to address the opioid issues. We need shelters and overnight places to stay, equal treatment, and social services accessible to pay attention to the needs. We are working on creating more of a source for these quotes to be publicly available. This is just a sneak peek that's probably going to be coming in the spring, but hopefully even this just gives a bit of a taste for what community members in your areas are bringing up. Okay, so that's all the data I have for you today. Sadly, I know it'd probably be fun to go on for longer. But we want to equip you with the resources to explore for yourself. So you can download survey profiles for the county, for the regions, and for those cities and towns. And we're going to be publishing in the next few days focus populations. We have a LGBTQ focused one. We have older adults. We have Native American and a couple other focus population profiles that are coming out. You can also look at the reports. A lot of these reports are pages and pages of data, so a little bit more in depth than these profiles. So if you like looking at tables, I encourage you to check them out. And then if there's things that you're seeing that you're like, hey, I'm missing data on a certain thing, you're welcome to submit a data request at this link, and our epidemiology team can take a look at it to kind of see what data might be available. All right, so let's talk next about, we've identified some of the CHNA priorities. What's next? So kind of the next ask of y'all is to participate in addressing CHOP priorities through the Community Health Improvement Plan and support the upcoming 2026 CHOP cycle. So we don't just look at issues and then move on. We work to embed those into our Community Health Improvement Plan, or our CHIP, which Irene Cassidy leads. So it's complete every 3 years in line with the CHNA cycle. It's required for public health accreditation, and it sets priorities and targets resources. So we know, what do we do as a result of all this, amazing information that we found? We went through a many months long process of assessing data from the survey and focus groups and key informant interviews, population data, as well as getting input from community members and our several of our kind of different planning boards. And here's the top 5 priorities: mental health, access to healthcare, access to healthy foods, substance use, and housing homelessness. So what's up next is that we are working to kind of further define what we're going to be doing, we as the county and also as the broader community, on some of these issues. So in September, we kicked off kind of that first introduction of let's do subcommittees for these different issues. Now we're in a period of having 3 different virtual meetings for really anybody to come and break out into topic-specific discussions and decide, how do we really want to focus in on what we mean by addressing mental health, because that's a huge topic. So you're in luck is that we have 2 subcommittee meetings coming up, one on October 23rd and one on November 20th. So we put the links in the chat there for if you're interested in registering. Again, coming to a subcommittee meeting does not commit you to working on this issue for the next several years, but it's really helping to include your voice in what direction we go when we talk about addressing these issues. And also our next quarterly partner meeting is on December 4th. It's going to be a great time. Lots of networking, presentations, etc. So mark your calendars for that as well. If you're interested in learning more about the improvement plan or the Health Improvement Partnership of Maricopa County, you can visit the website, contact the team, and subscribe to the newsletter. The newsletters are so good. There's like great photos and links and information and profiles. So I definitely recommend signing up for those. All right, with that, we have 10 minutes. Alexandra, I'm going to turn it back over to you to facilitate our Q&A and evaluation portion.
Thank you, Annie. So let's see. I don't have access to any questions in the chat, or we don't have any questions in the chat. Annie or Irene, do you see any questions in there?
It looks like there's one. How are we defining white in the report? I also want to invite anybody else, if you have questions, you can, in the chat, you can send it to Irene, Alexandra, or myself, and we have some time now to get into those. So we'll talk about how we're defining the race ethnicity categories. Sorry for hope we are not getting seasick right now. Okay, so you're going to notice that when we look at the breakdown of the population versus respondents, population does not, it adds up to more than 100, because the US Census, they report Hispanic Latinx as an ethnicity separate from a race. So a lot of individuals who are Hispanic Latinx, they'll select whatever race they identify with. So it might be white. and then would also select Hispanic, Latinx, yes or no. For us, we went through a lot. We did a piloting with 80 community members, lots of different organizations, had a lot of discussions about how to best capture race, ethnicity, and because we did get feedback that for a lot of folks, maybe don't necessarily identify with another race group than Hispanic or Latino. So we actually included that into the overall survey options. So our blue dots of respondents will add up to 100%. So folks had the option of indicating any of the race ethnicities that they identified with, but Hispanic and Latino was an option in that overall category and not a separate race ethnicity. So the way we're defining white is basically if anybody identified themselves as white, and it could be somebody could mark that they are white and Hispanic Latino, or they could just mark that they're white or Hispanic Latino. So there's not as much of an overlap of that data as there is, for example, in the US Census. We do have online with our different reports, we have published to what the survey questions look like. This was our most expansive demographic survey ever. So you could select your overall race category, and then it popped up with ethnicity too. So we have, so for example, for white, there was a lot of subcategories of, mostly of European descent, and as well as each of our different race ethnicities. We had a lot of options, and folks could write in, other specific ethnicities that they identified with. So we haven't done too much on that analysis at that level yet, but it's there and we have it for maybe some future analysis. I hope that responded to the question. Let's see, are we getting any other questions in chat?
I don't see any other questions. But we do have 7 minutes left. So I do have one question that I'd love to hear from community partners. What was your experience? Do you feel like this presentation was helpful? Do you feel like it captures what you're hearing and what you're seeing in the Southwest Valley? And again, feel free to throw your responses into the chat. And then this is also the QR code for the survey. For the evaluation, I'm sorry.
While you're taking a peek at the evaluation, I did see we had another comment about we have a growing immigrant and refugee population. White might not completely capture the experience of those groups. Maybe reassessment how that data is captured could be helpful. Appreciate the comment. I think that maybe feel free to reach out to via, we have Alexandra's contact info if you'd like to have kind of like a longer conversation about how some of that data is captured, along with race, ethnicity, and those sub items that we talked about. We actually did have another category that is not, it's unfortunately not on that population comparison because the US Census captures data differently, is that we did have a Middle Eastern and we had like a Middle Eastern, Northeast African category, because that seemed to be more indicative and reflective of a lot of our refugee populations. And that is one of the challenges of when we're trying to make some of the data like more relevant for our community, but we don't have national measures to compare it to, it gets complicated. So if you look at the survey report, we do have that specific racial category called out as well. I'm not sure if that responds to the question, but would love to chat further about kind of how some of those are identified and the pros and cons of getting specific, but then not having the national measures to compare. How was poor physical health identified? Self-perception, or was there something that helped people quantity or give meaning to that question? I love this. I'm going to pull up our survey tool and show y'all kind of how we ask some of these questions, because I think that'll be helpful. All right, are you able to see the website here? Okay, so if we come to the website and we click this community survey button, this is the one I was talking about that has like all the data tables, lots of write-up about how different measures were captured, etc. Here's the category. We also had Middle Eastern or North African. So that was an available option. Again, you don't see it on the profile because it didn't have the national comparison, unfortunately. But for every single question, we have those respondents broken down, which is cool. If you scroll it's in the questions, but if you scroll all the way down to the bottom, you can see what the survey tool looked like. So when we asked, I'll zoom in. For physical health, we said, how would you rate your physical health, such as how your body feels day to day? Very good, fair, poor, prefer not to answer. How would you rate your mental health, such as your mood and how you handle stress day to day? So, you know, we gave that kind of level of detail. But yes, it's very much a kind of like a self-perception type of question. And then you can look down here. We also had, here's all the different options. We talked about community assets. We provided a ton of options. Demographics. So here is how it looked for race ethnicity. So folks could select their overall and then their sub ethnicity if they wanted to. So so we have data on all of these different categories. But yeah, I'm gonna pop this, and we also had, like, for multiracial, we had because sometimes for analysis we need to kind of collapse that to one. So we also asked folks to identify, if you are multiracial, is there a certain race ethnicity you identify with the most, or identify as multiracial in general? So this was another way that we kind of gave that decision making back to the participant instead of making it on the analysis end. So I'm going to pop that. I think we've already probably put it in the chat, but I'm going to put it in there too so that you can all see it. Yeah.
All right, well, we are at 11:28. Do we have any final questions, Annie or Irene? I don't see any on my end.
I see any plans for asking about adverse childhood experiences the county has surveyed in the past, and the CDC also identifies its association with major health conditions, disparities, and social determinants of health. I can speak real quickly for the CHNA, which is that we try to ask questions that are a little bit different than questions that come from other sources. So for example, the Youth Risk Behavioral Surveillance System survey, or ACEs studies, because we can pull that data in to kind of look at the full picture. So I think that some of those are potentially informed, but I doubt that. We don't usually have like the space to add like a whole module on the ACEs. That is from the data side. Alexandra, do you have any other kind of thoughts on or feedback on that one?
Well, I think one of the things that we also want to keep in mind is that this particular survey also serves, and I know we didn't get into Synapse, which is our partnership with hospital systems. They also utilize the data that's coming out of this CHNA process. And so there are some questions. I guess what I'm trying to say is there's a variety of entities that are invested in the types of questions that are being asked, because we then want to be able to utilize the results and create some work that actions those results, I guess is the best way to describe it. As Annie was mentioning, those community health improvement work groups, committees, that's really where I think you'll start to see the social determinants of health, the ACEs, that kind of framework really valuable, really useful, because we can lean on those two pieces of framework to say, so the issue is access to healthcare, or the issue is drug use, or whatever the issue might be. How can we tie that back to ACEs as more of a root cause solution versus working from asking people to self-disclose that those adverse childhood experiences have taken place in their life. So it is definitely tied in. And I think that the individuals, such as yourselves, if you decide to join those committees, you really do have the ability to inform the work and make sure that it's being viewed at through ACEs framework or social determinants of health or any other framework that you think would be beneficial to the community. And with that being said, it's 11:31, so I will wrap up this session. Thank you so much for joining us. This is the first time that we have the Public Health Liaison Office has collaborated for this type of presentation, so your feedback is greatly appreciated. And if you're joining us, again, thank you. We will get the recording and the PowerPoint out to you all in the next couple of weeks. Thank you.
Thank you.